She can now farm her land. But for Flavia Chomhendo, a 42-year-old mother of 5, life was not like this a year and a half ago when she almost perished at the hands of her relatives. She had returned home with some of her children after a divorce and tried to start life afresh, living on a piece of land allocated to her by her parents. From her village of Kitonozi in Bwijanga sub-county, Masindi district, she recalls the day she almost lost her life.
Bakanyirukana kipanga nibenda kuntema obukomero bw'okurorobo nkabambyere mena nasi zona bazibura mpaka kuli banyirukana kiso kuntema nyagwa na hali nefuka yange bakagitwara natitinka gifunaga achwere mkimu esirime yangere kunyita leka bante mateme banyite nukuba twara bukiweka bwange bono bwona.
When she escaped from her tormentors, she took refuge at the neighbor's house and continued accessing HIV services at a local-based service provider. On one of the clinic days, UGANET legal officers came to give a talk about human rights. That is how help came her way.
Hati ekitongole iki kyatugamba tutabonabona bo baloho kutukwata mukono nuko tutenuga tukekole bibi nyote nkwadupa buzibu bwambikira hano kabanchire mu kuita habo kwanka buzire no busingi ningira anti businge mundemeni bangambe silime kisilimu kiyaki ohali kweha nero naiwe uja kuikara hao nibambuliza kimwe busingi ndemere kimune kiyokora.
The Uganda Network on Law Ethics and HIV/AIDS, UGANET, was established in 1995 to bridge the gap between human rights, legal, ethical, and policy issues, and HIV/AIDS care and prevention. Its legal officers and paralegals work in disadvantaged communities, educating people about human rights and offering legal aid to the vulnerable members of society, particularly those affected and infected by HIV/AIDS. UGANET works in the 5 districts of Uganda: Kampala, Palisa, Ntugamo, Lira, and Masindi. Each year, it ensures that increasing numbers of people in marginal communities get help. It is through meetings like these where Chomhendo came to be aware of the free legal aid services.
Aba UGANET nkubesimisa muno habo kubanka bandemera obusinge buli hali nyakagenda gekirwali kiasilime ekyo kirifuadi hitwa kiejuna buli hali nyakagira ganti niko kuchamu kugamba kabanteme banyite nukubiteka bintu byona babitwale kyonko bunyagenzero mu kitongere eki nyabasobororera bayija hanu bangamba guma otafwayo itetuloho nibankansolenga koka kihura nyahura ngumire bangumya hati bano bayizire kana kachweka kabatwaye bagamba leka bakatwale nyabagamba mpeme sente bampeme sente hati nyo bangamba kanu nikakange bakangarora kana.
Milton Mpurwa was the Secretary Local Council 1. He's also Chomhendo's neighbor, who sheltered her during her time of distress.
Gali mazima kitongole kya UGANET nikiyamba abukuba we kune nyuma kunoona kabatungiremo kuziringitanizibuwamu kyonka kandi byayikira irukiro uko twazoka obukonyezi ya butunga bwa amani kubona batayikale ham bakayimukiramu bayija barura kike kikutabura dina nyuma yo batwikaza babasobora bulomye yitegereza okuba atale ebintu bitugenda tukora tutayino kumanya.
Justice Dr. Esther Kisache is one of the founder members of UGANET.
We started UGANET in 1995. By that time, it was almost 10 years since we had started to openly speak about HIV/AIDS in this country. But in most cases, the HIV/AIDS response had taken on almost, I would say, first it was a purely medical response, where they said protect yourself, avoid the virus, and everybody at the time in the country and up to now, they said awareness levels were 98%. Then we tried to broaden, when the government multi-sector approach broadened that response, again it was looking at some of the moral issues, don't have many partners, because you're exposing yourself to the epidemic. What the government response at the time failed to respond to was the fact that particularly, for some groups, the vulnerable groups, and I would cite the women, for example, in most cases, they don't have a choice.
Today, UGANET has reached thousands of people, creating human rights awareness, and continues to be a major advocate for the vulnerable groups, creating a vital link between HIV/AIDS and human rights.
UGANET's work is at different levels of community. In grassroots community, we've been undertaking a legal aid project where we support vulnerable groups of people. This includes women, children, persons with disabilities, women living with HIV as a cluster, to empower them around rights, to help them get socialized and mobilized about human rights. They are able to demand their rights when they know. Then we go ahead to provide the legal aid as a service to make sure that when their rights are violated, they have support. They undertake legal counseling, then they can get legal representation in courts. Our lawyers have been in the 5 districts of Uganda making sure that they support the grassroots communities.
Joanne Nyakato lost her eyesight 7 years ago when she fell gravely ill. The 40-year-old mother of 4 had already lost her husband to AIDS. Her vulnerability made her a target for social discrimination because she lacks a social support system, save for her 15-year-old son, Mujuni. Mujuni fends for the whole family, which includes a 3-year-old sister. He has fallen behind in school because he often misses classes to do manual labor so as to earn money to feed his family. Their desolate financial situation does not attract sympathy, but people intent on grabbing whatever property they inherited on the death of his father.
Otie na mdoti guliyo kuli. Otie na miyemine jaka. Oika mwomozi. Alone kiswa kikarugam. Anorabe. Yikaza umukaga nikichiweka. Akabampaye msanji nikichiweka. Tionkola ikema. Bagiva. Bagituwa. Tilelo badi akapui. Barabambana. Abandi bakabalekeye nanka kiramu bandi basereka ibura ndogo kiamu yeije yakola yakabali wakiema bamwetaga Kasaidi yeje yakisoma yagamba bagwese n'umwana wa Nyakato mu Kitogo we mujuni bati akandika ninende yo mwana wangu gutereza ali wa isomero adi yagamba mkazi ono mwaile kikiweka kiamu kinaikala kiongora abantu bachiwamu bagamba busaho akwategwa amage.
Nyakato made countless attempts to evict the people who started settling on their land. But with UGANET's legal intervention, she now has her land back.
Ati bakabangire munyagamira Bachemani balemwa nyagenda nyagamira batasa ati batasa bagambira gani yeije ya nyamba na Bachemani basamba n'emitano bali barugama ati ne barwaze nanga eitakaliana.
Partnerships with other HIV/AIDS service organizations are important in UGANET's work. It was through such vital linkages that Nyakato property problems were relayed to the UGANET staff. Berina Kamahoro works with the AIDS support organization TASO, where Nyakato gets medical services.
After receiving Nyakato and she already had her concerns. Concern number 1 was issues to do with her health and supporting for children. But later on she came in with other challenges of land. After that, sometime after her treatment, Nyakato had a challenge with land grabbing and property from her house, we were able to liaise with our partner UGANET. We wrote a referral letter we gave it to her to take it to UGANET for legal support. We were happy that they supported her with the help of police.
To widen the reach of its services, UGANET works with paralegals, mainly people living with HIV, who have been given basic legal training so that they can move further to spread the message. Through drama, they train people about their rights, using the language that people can understand, depicting situations that people can clearly relate to. Messages on domestic violence and child neglect are strongly driven home. Talks on individual rights and how they should be protected are a fundamental part of these community meetings, particularly what one ought to do if such rights are violated. William Kamba is a paralegal trained by UGANET. He works in Palisa district.
I educate them on their rights. I educate them on their on domestic violence. I educate them on will making. I educate them on these bad cultural practices like widow inheritance. I also tell them that it is a right for all people to access treatment in all health facilities in the country.
UGANET staff often conduct will-making training sessions alongside the paralegals to strengthen their competence, as well as to answer the more complex questions which might arise. Here at Palisa Hospital, the UGANET Program Officer for Palisa, Kathy Annette Nanyanzi, is taking time to clarify matters on property inheritance. Many questions are raised, but at the end of the session, many walk away enlightened on how to put their houses in order.
They have learned to make a will, so that the day I die, I will leave my property or what I've sweated for throughout my life in somebody who is responsible for them.
Land inheritance is a major problem in cases where a head of the family passes on without leaving a written will. Land disputes form the bulk of the workload that UGANET legal officers deal with.
The cases we handle mainly include land disputes concerning mainly the widows. When these ladies lose their husbands, they try to grab the land from them, especially if they are HIV positive. So when UGANET came in, we fight for such people's rights. They come to our office, then we mediate. Where we fail to mediate, we go to courts of law, and we get redress from courts of law to their advantage.
Land problems are even more common in northern Uganda, a region that is just emerging out of 20 years of insurgency, which caused internal displacement.
After the war, when people started being resettled back by the government, you realize that boundaries were disturbed or removed in whatever form. So you realize that the people, some of them could have died, or some of them, as a result of staying in the camps, could have gotten partners and gone back to areas where they were formerly not there. So the issue of land just became like a natural occurrence, whereby people would come up and say, I used to stay here, my land used to, pass here. So because of no proper mapping of these lands, you see that a land dispute arises each and every day, and those actually land problems form the greatest number of disputes and clients that we receive in the UGANET Lira office.
Lydia Ogole now lives with her son in the outskirts of Lira town in northern Uganda. But she's a landowner in the neighboring districts of Dokolo, 40 kilometers from Lira town. She is still readjusting to the fact that she regained ownership of the land, which was almost taken from her by her extended family members. She now travels home regularly to check on the home she once shared with her late husband. She had fled while the family wrangled over the property. Her going back has been made possible by UGANET.
Groups में positive livers chaha beri na kolas atebere weki rotu ba atebere cosbel kun cosbel poki wacheme mume otuo karme cosbel poki wacheme otuo discussion binu ni manu enu jo apol ko ni kargin re ko tuo jo kwero gi ko kede dano ko testimony mere kita beru tuo ye kede kitu nyome kede kita jo achogo kwere kede aya dong tam te bere tie jo ken no ti ne group asama kubere kede UGANET dong puonyo wani kai ti peho ti jo mora me ti obira me chunge gamente ame konyi mo bere ul ko ni UGANET kai ni ti peha me jo ayeli ini iwor bodgi.
The community role was instrumental in providing the guidance to the mediation meetings which resolved the dispute. Saverino Opio has lived in this village for all the 80 years of his life. He participated in the mediation meetings.
Loboni ogole disa tanyomo chege maloni Lydia inogolo nyomoni otado poko te poko Lydia chi ogole kedo wore kok danere jare ko bediye wante poko loboni apot bon wo moro awitong dan tiye Harasi kanda tiye, jaga teke dang tiye. Ante pokolo ni bonko paro.
They agreed to demarcate the land among its rightful owners. The grueling fight for her inheritance is now over. She has secured the resources to provide for herself and her children.
Atwara dwa ko poj bod UGANET. Piena mana wara puru porro. Kadi dungi no balo jamina. Nugi otiu kwala me wo balo jamina. Temu donga balo kuo. Etu no tiu luoro chik. Anado UGANET konya do angeo chik. Gin dungu kwalo balo jamina kwala. Balo uton dogola kwalo jamina moti oto kwala. Pe amaho dani.
At age 17, Gloria Kembabazi would have been too young to stand up for herself in a land dispute. But she and her younger siblings recently won a court case with UGANET's representation to recover their late father's land, which had been fraudulently sold to a neighbor.
UGANET bakatwakira je kandi mazima batwereko obushagishiki bija baturwanira baturabyo muko bija bayitoga omushija bamubuza yayenda gano zeye okuyaba kozirewe na mawitwe keze kuzihayo yayemera bataho mwene ngere yibakubasa kubutereza omushisha ajachi yayanga niko tukagumizamo mukoti tukahoza abayiganet bakatworereza byona bakabitarabyamo tukahika kusingura ikibanje.
More clients are getting to know about UGANET through public education messages.
We have had our programs on radio. We have got outreaches where we go and teach people about their rights, their property rights, and how they should, look after their families and settle them before, things of the sort come in.
Sometimes what starts as a land dispute escalates and takes on other forms of human rights abuse. That was the case with Gloria Chakwera in Ntugamo district, who became a victim of relentless domestic violence until she almost lost her life.
obwo nangwa kana yenda kutera umutwe ati umutwe nuko kureta sitani zo butagenda ati nagira nto mukono yatera igufuri iri ati nahindika n'umukono mbwenu aba harweka y'umwara bahoreba aha ibati abo nibo bwizire bakankereza bakantwara wabo batumaho baramubangiye bwija bayeta motoka nyekiro bantwara umwirwaro.
Gloria is married to a polygamous husband. After giving birth to 3 children, her husband wanted to get rid of her so that he could remain with fewer mouths to feed. When she withstood the beatings and would not abandon her 3 children, he devised a plan to physically remove her from the land.
Hati kubarebere nayanga bo bankwata bate bankirizo bagenda bantu mumotoka batemba bakinga.
She was dropped off in a village 200 kilometers away, but she came back and sought help at UGANET Ntugamo offices. Her case went to court, but it was soon mediated and resolved. She's been given a place to raise her children, and the husband was warned to stop beating her. UGANET is taking the lead together with a group of NGOs, including people living with HIV, to voice concerns on the legal implications of making Uganda's first legislation on HIV/AIDS prevention and control. Although the law is intended to bind government to cater for people living with HIV by providing funds for their treatment and control activities, there are provisions in the bill, if passed in its original form, that could lead to stigma and discrimination. They would also create difficulties in implementation because fewer people would go for testing and seek treatment. Dr. Brian Asimwe is the chairperson of the Social Services Committee of Parliament, which has been mandated to scrutinize the bill before it goes for debate in Parliament.
The bill has many sections. Many sections are okay and have not been, they are not contentious among very many people or before very many people. But there are other sections, few sections, which are a bit contentious. One of them is the criminalization of intentional transmission of HIV. That is, I think, the most highly contentious. And another one is about attempted transmission. That if you attempt to infect a person, and you should be taken to court. There we have a problem of proof. And how do we define attempting to infect a person or transmit HIV to that person? That's another area that has generated a lot of debate. Another one is disclosure. It has also generated a lot of debate.
UGANET identified these issues, which could reverse the gains Uganda has made, which brought the prevalence rates down from 15% in the early 1990s to current prevalence among adults estimated at 6.4%. They've held meetings and public dialogues to ensure that the damaging clauses are removed from the bill. Government representatives and members of parliament have come and listened, and the issues of concern are beginning to sink in.
UGANET has met us, I think, more than once. And one of the issues they raised was deleting criminalization of intentional transmission of HIV. And I think they have a point because they think this will make people not come out. Many of them, people living with, for example, people living with HIV/AIDS have come out voluntarily. But if you're going to isolate people living with HIV. That is going to make people hide and don't come out, because they know if they come out and they are known, in case anything goes wrong, they'll be taken to court, something like that.
The struggle against HIV/AIDS continues, and the need to safeguard individual fundamental human rights remains at the center. UGANET has registered key successes, but a lot more is yet to be done. Tinka Ignatius Zarugaba is a district CID officer in Masindi. He carried out the investigations in the Nyakato case.
UGANET has had a great impact. If we take Nyakato's case, to sum up other cases, one, Nyakato was able to receive her mattress back. But not only that, when police and the UGANET went on the ground, we realized that the problem were neighbors. Nyakato being HIV infected, being a person without relatives, without a husband, without anybody. So the community around wanted to use that disadvantage on Nyakato to take everything of hers, including land. And we shared, and the UGANET took it a responsibility that the land of Nyakato should be titled.
You find many more people who realize that, who acknowledge that there's a link between HIV/AIDS and human rights. You find many HIV positive people who are able to stand up, come out and openly, bring out issues when they face discrimination at work, in health centers. You find orphans coming up, despite the fact that they haven't reached age. Through our legal aid and radio programs, you find orphans, even if they don't have an adult speaking for them, at least seeking out legal aid service providers to say, I'm not going to school, my father was. But my father was working here, and we need to help to follow up our property or, the benefits.
The successes are, however, against a backdrop of an epidemic that is still spreading, leaving in its wake vulnerable people, particularly women and children. Their rights continue to be abused. On the other hand, human rights abuse also forces some people to engage in behavior that may lead to the spread of HIV/AIDS.
There is a lot that can still be done. For example, sensitization has to go ahead because sensitization touches an attitude, and you cannot change an attitude within a day. So you need to continue telling the community members, no, you do not have to discriminate against people that are living with HIV. So it is a process, and in this process, they need to continue hearing these messages, respect the rights of people living with HIV, so that at the end of the day, probably the next generation shall have no discrimination on those grounds.
My appeal to the civil society, to government and other development partners, interested to make sure that we don't lose the fight, which we have started and we have invested a lot of resources in, is to continue with the same focus that we need to reduce the infection rates by making more and more people getting knowledge, making sure that we protect human rights, especially for those vulnerable groups, and that so that even UGANET is able to continue this crusade, this struggle of making sure that Uganda and maybe elsewhere can still live with this disease, but more decently, and therefore without victimizing people, but only giving them knowledge to cope with the situation, and eventually to be a keeper of one another, which will definitely lead to reduction. And we are hopeful one day this disease will be overcome.